Alright, so we're going to be going over the IFC machine here. I'm going to flip the machine on. Just loading it up. There we go. So we're going to hit our electrotherapy option, our interferential, which is what IFC is. We're going to edit this right here. Now there's a couple options here that we need to focus on. We're going to hit our vector scan. That's going to be on. That's going to determine how the flow of the electrical currents goes throughout each pad. As you can see here, all these numbers indicate the positioning of each pad. So I'm going to be placing that on my shoulder, and so whenever the machine gets turned on, they're going to have one channel right here and one channel right here, and then so the treatment area is going to be everything that intersects in the middle. You can change the degrees either higher or lower. As you do that, the overall surface area of the treatment gets affected. So we like to keep it just at a 45-degree angle to ensure that it all gets evenly distributed across the treatment area. From here, we can also alternate our beat frequencies measured in hertz. The lower frequencies that we have are going to be stimulating more of that opioid release effect, versus the higher numbers are going to target more of the gate control theory. So it's going to be more similar to tens, but a little more intense. Just going to take it to 150 here. Oh, actually, I'm gonna go back and change that back to where it was at. Let's take it to 80. Perfect. So 80 to 150. Our carrier frequency, we have 2500, 4000, and 5000. So we're gonna just keep it at that 4000. This knob here is gonna control the frequency, and as you can see there, it's gonna affect both channels evenly. One thing to note on this is the frequency duration. The lower numbers are gonna target more of the superficial tissue, since it's less time spent being able to transfer the energy. It's not gonna reach too deep, versus when the numbers are higher, it's gonna have more time to penetrate deeper into the tissue. So with that being said, I'm gonna attach on pads to my arms and we'll get started. Alright, so we'll go ahead and start our treatment here. I'll set the intensity at 2.0, and then we're gonna crank it up from there. A couple other things to note here with using IFC. There's no ramp time for this, so what you set it at, you're going to be feeling that right away. There we go. I'm ramping it up to, got it set to 5 right now. Since I do have the beats at a higher hertz frequency, it's gonna be that buzzing, tingling sensation. If you start going high enough, you'll start to get a contraction going on there. There we go. And so that's just a constant buzzing sensation. Got it up to 9 now. If you can see there, got my deltoid buzzing like crazy. It's feeling pretty good. Ooh, 10.5 right there. It really, you can feel that buzzing intensify. So we're gonna make some adjustments here. Pause. So we're gonna take the beats down to the lower levels to try to get that opioid release. So I got the low beat set at 2, and then the high beat is gonna be set to 10. Ooh. Yeah, I didn't lower the intensity on that one. You can definitely see a lot more activity going on with that one. Get some movement going on in there. And that one definitely triggers more muscular contractions. Posterior deltoid going crazy, which makes sense. I don't have the best posture, do a lot of slouching, and so that posterior part of my deltoid and my rotator cuff are pretty tense. Oh, look at that. Oh, now it's ramping it up to, it's 11 right there. Starting to be more of a intense contraction. So now it's at 12. Starting to get more of the pins and needles sensation. There we go. I am noticing, I put these on myself, but I'm gonna pause it all here and readjust this pad. It's a little higher so it can be more spaced out. This one. There we go, they're in better position there. So okay, that actually feels better. A little more buzzing and tingling. There's 13 intensity. Probably wouldn't go more than that. It's an even blend of muscle contractions and buzzing, tingling sensation. And it's going to be continuous. There's no on and off time that goes on with this. So it stays continuous. The ramp time doesn't happen either. You're going to feel that right away. As far as the amplitude, you just want it to be a comfortable tingling sensation. I'm just messing around with the intensity here. For me, I kind of like the blend of both because the tingling, buzzing is comfortable, but I also want those contractions to stimulate that, increase that blood flow to the area and get more circulation going. It's gonna help with flushing out anything that needs to get flushed out of there. Total treatment time, it'd be anywhere from 20 to 30 minutes, but I'd say, yeah, about in between that, you don't want to do more than 30, and anything less than 20, realistically in a clinical setting, It'd probably be way less than 20 minutes, but it's really good for controlling that pain there. Get the best of both worlds, the opioid release as well as the gate control theory. I'm gonna start messing with the vector positioning there, see if how it changes. So I can definitely feel how that changed it down from one channel. And then, let's see. Let's take it back to 45. So as you change the degrees of the vector position, it's gonna make one channel less than the other. Let's see, we're gonna increase it here. Yeah, so as you increase it past 45, you're gonna feel it more in one channel versus the other. That kind of takes away from it. Oh, there you go. So a lot more buzzing on one end. A lot more buzzing on one end versus the other end. There we go. So on these two channels right here, I'm feeling the contraction pulsing, and then on the other channel, I'm feeling just more of a buzzing sensation. I think for the most part, there we go, I'm taking it back to 45 so that it's evenly distributed. That seems to be the best option there. Makes the deltoid work like crazy. Yeah, just explaining this to your patient as to what all these sensations are gonna feel like, and then just having that even distribution of patient comfortability versus what you're trying to achieve with this. So if it's pain control, you know, it's not gonna help them with the pain if it's painful during the process. But you do want to make sure you have just enough power with the velocity so that it can achieve that opioid effect. But yeah, that is the IFC machine there for you.